So we operated you for varicocele, right? How many days now?
Until the third day.
3 days.
3 days.
3 days after the
3 days,
procedure.
yeah.
Now, the first control is very important.
Mhm.
We had your video before the procedure.
Sure.
Now we will compare. This is testicle. Now I will look if there is any blood coming into testicle. Very important.
Sure.
Okay, so this is nice. Yeah, the circulation in the testis continues.
Mm-hmm.
This is nice. And the second thing,
That's on left.
yeah, left side.
Okay.
And let me see the right side also. This is the right side. We just operated left side in your case.
Sure.
Yeah, so now I will look to operation side to see if there is any remaining vessel. You know, we try to take out all the vessels,
Yeah.
and it was nice, it was successful.
Okay.
So let me find the spermatic cord. I think this is the spermatic cord. Let me see it through. Okay, this is coming to, yes. Yeah, this is testicle, and these are the vessels coming to testicle. Do you remember you had very large veins
Sure.
before the operation? We recorded them too. Now there are little tiny, maybe 1 millimeter veins, because we take out all the big veins. This is spermatic cord. It is seen a little whitish. That means there is still edema, swelling after the operation. Now when I look with Doppler, we see the pulsation of the artery, and we don't see the veins. This is good. And please strain, push yourself. Yeah, when you strain, the veins just filled a little, short time.
Okay.
And this is a normal structure now.
Okay.
It must be seen like this.
Okay.
So, how was the post-operative 3 days?
Mm-hmm.
What was your experience? What happened? Was it painful? Tell me, please.
It was not that much painful.
Yeah.
It's only now when maybe walking you feel like you're straining a little bit, but when I'm relaxed, no
Yeah.
pain.
So, did you
Okay.
walk a lot or did you rest? What did you do?
So for the first day, I rested in the hospital.
Yeah.
Second day, I went home, and now today, the third day, came for the checkup.
Okay, so we operated at
Monday.
Monday. So Tuesday,
I
you go to hotel.
Yeah, sure.
And was it far away from hospital?
Yeah, it was far away, but I managed with a taxi.
I want to ask you a question.
Yes.
I don't arrange
Mm-hmm.
the travel issues, hotel issues, and
Sure.
transfer issues because
Yeah.
I think people take a lot of commission
Yeah.
for these.
Sure.
When there is an agency,
Mm-hmm.
I am not sure if it is beneficial for the patient or too much costly.
Mm-hmm.
So I usually don't leave the patient to decide himself.
Sure.
If he asks me special assistance, we have some companies arranging, but they are costly.
True.
So what's your opinion? Is it better for me to arrange such things or just to leave the patient itself to arrange themselves?
I think for the patient is better.
Yeah.
Because maybe you also want to tour around to see Turkey by yourselves,
Really,
have
yeah.
your first experience.
Yes.
Yeah.
So if in Istanbul, you can find many kind of hotels.
Hotels, taxis,
Taxi
and
is
variety
easy.
of services. Metro.
And eating, for example.
Sure.
You can find very cheap eating around
Sure.
the hotel.
True.
So for me, the best thing
Mhm.
is to leave the patient to arrange
Right.
from there's in the internet, travel.com, booking.com, many
Sure.
possibilities.
Sure.
So I am not doing it, but it's possible. Sometimes people asking me, why don't you arrange all this?
Yeah.
It is costly because I have to agree with the company.
Yeah, sure.
They want to make money.
Yeah, everyone is in business.
So, and I don't use any commissioners. For example, sometimes there are travel agencies,
Sure.
health tourism agencies.
Sure.
I want to find myself the
Mhm.
patient from YouTube
Yeah.
because sometimes very strange.
Mm-hmm.
The agencies,
Mm-hmm.
health tourism agencies, they charge sometimes double the
price.
doctor price.
Yeah, true.
I can't believe. I say my price is this,
Mm-hmm.
and when I talk with the patient,
Yeah.
oh, he
Mhm.
paid the double
Double
or 3
the price.
times.
Yeah,
I
sure.
ask. So I don't like to do it that way. Best way is like now. This is very nice.
Mm-hmm.
Only arteries are remaining. The veins has gone. We take out a big vein
Mm-hmm.
from your testicle.
You said it was about 25 centimeters.
Yeah, it was 20 to 25 centimeters.
Okay.
It's very nice.
Mm-hmm.
And so post-operative third day, the testicles seem normal, a little swollen, and I can see the edema here,
Mm-hmm.
but it's good. And will you go back to your country? When will you go back?
I leave on Saturday.
Saturday. So
Saturday.
you are operated at Monday,
Monday.
and you come to Turkey what time? At
I came on Thursday.
last
Week on Thursday.
Thursday. So
Yeah.
you have some sightseeing
Some
here.
site, some visits.
Okay, this is nice. This is nice. Istanbul is a very touristy place.
Yeah, sure.
People can come here before the operation. We have you can spare some time for sightseeing.
Yeah, sure.
This is nice. Okay.
Thank you. You know, I can